Hey, everybody. Welcome to the Untrivial Podcast. My name is Allie Nelson. I wanted to give a trigger warning today because we are going to be getting into the topic of fertility and fertility challenges. And I'm going to just go into my solo moment at the beginning of the episode instead of the end because I think it's really important to take a lot of care and compassion with this topic. Fertility for a lot of people is such an emotional topic. If you desire to conceive a child, I think it is very emotional regardless if you have challenges or not, but I think especially if you do run into challenges along that journey. This, of course, affects both men and women, but I do feel like women wear this a little bit more and do talk about this topic a little bit more in their social circles. And I think it's really natural that when you are approaching your mid to late 20s or early 30s, these conversations do naturally just start taking place within friend groups. And I think all with the best intentions or meant in a harmless curiosity. But I think it is important to remind people that you may not know what someone is going through or has been going through. Even questions like, when do you want to have kids? That person could currently want to have kids and have been wanting to have kids for years and struggling. That can be a hard question. Or something like, oh, you don't want to give your child a sibling? You have no idea if they want to give that child a sibling or if they've been trying desperately to give their current child a sibling. It is so assumptive sometimes, and we just don't even think about it. But really, you just never know. And I think, as I mentioned, there needs to be such gentleness and compassion when we're exploring these topics because it is so unique. Every person has such a subjective experience, a unique experience, but also has kind of different unique emotions that might come up for some people and not others. Something that wouldn't upset one person, like a question around how family planning is going, might really upset someone who maybe unbeknownst to you has been trying for a while or has just even experienced a loss. I think even with sharing news around pregnancy, your joy can be really bittersweet to someone else. And so, how do we make space to respect their feelings and experiences while honoring our own at the same time? One example I can think of is how I shared the news to some of my friends that I am expecting. I wanted to give them space to have a reaction that was authentic to them and their feelings, something like frustration, and allow them to process that and respond in their own time, if at all. So something like texting a friend instead of sharing in person. This is really subjective too, right? Like I think everyone is different and will appreciate different things. But I think really if you have a friend struggling with fertility, give them space and let them open up to you when they feel like it, and just don't pry. And if they say to you, hey, this is something that's going on, but I don't really want to talk about it, all you can do is let them know that you're there for them. But if and when they're ready, they will come to you and talk about it. To anyone going through a difficult fertility journey right now, I'm hoping you get your miracle and find success and keep the strength that you need to navigate this process. No one will ever quite understand what your journey is like for you. And I'm genuinely not sure there's ever a right thing to say. But there is love and support all around you. And I know that there is so much resilience within yourself. And I know you didn't want to have this level of strength, but I am hoping for you and I'm hoping for your miracle. With that, my guest today is Dr. Beck Hoehn. She is a fertility expert, a board-certified acupuncturist, and herbalist. She is based in Los Angeles and is also the owner of her clinic, Mighty River Wellness. She has a master's degree from the Emperor College of Oriental Medicine and received her doctorate in fertility acupuncture. She is dedicated to helping women overcome obstacles in their journey towards motherhood and offers a personalized approach to each individual's needs and circumstances. I will say this episode is a little bit more unconventional. It's a little bit out of the box. We talk about things like yin and yang. We talk about qi. I would just encourage you to be open to it. If you've never listened to a conversation that is a little bit more oriented towards Eastern medicine or traditional Chinese medicine, this could be really new and interesting for you. But just wanted to preface that, yeah, it's a little bit different than maybe a Western medical approach to fertility conversations that you may have heard in the past. I'm really just trying to learn and speak with guests who have really interesting points of view. And a lot of times they're perspectives that I've not heard before or haven't really familiarized myself with a ton. And I love that because I'm learning every day. More details about her clinic and programs are also linked in the show notes. And lastly, if you like this episode, please share with a friend or leave a 5-star review. And now, let's get into the episode. Dr. Hoehn, thank you so much for joining the Untrivial podcast today. How are you?
I am amazing. Thank you. And thank you so much for the opportunity to talk to your listeners.
Oh, absolutely. We are so excited to have you. I know so many women and men are so curious about fertility, pregnancy, especially with techniques and tools and medicine that they may not be super familiar with. And so I'm so excited to get into this conversation with you and talk all about whole systems medicine. So, for those who don't know you, I'd love if you could share a little bit about your personal background and how you got into this space.
So I have had a lot of different careers to say the least. The main one was I was in the camera department in the film business for 25 years. And I had an injury at work. And the only thing that got me back on my feet was acupuncture. And at the same time, my now mentor also treated me for painful periods. I used to have periods that were so bad that I just used to throw up before work and then take some Advil and go
Oh
to
my
work,
gosh.
which it's not funny at all. And sadly, I realized in that space that the medicine was so transformative and so astounding. I felt like I really needed to go back to school to study it so that I could serve my community. And my community being at the time female camera people. So I really kind of took it to heart that other people on set were also suffering like I was. And I really wanted to figure out a container or a silo where I could actually serve that community. And then after that, after I studied and got my master's degree and started studying the medicine a little bit more, I realized that there was a really underserved community in the fertility space and trying to conceive. And so then I decided to get additional training in reproductive health as it relates to TCM or whole systems medicine. And then a couple years later, I said, well, I really wanted to learn about fertility acupuncture and research. So then I went to school to get my doctorate to study that a little bit more so that I could really serve my patient base the best I could.
That's amazing. Yeah, and you're so right. I think there's so many people who are so curious about their fertility and their ability to conceive, and a lot of times you only approach these conversations once you're struggling, and that can sometimes be a really big challenge too.
That is so true and such a great observation. I think that it's a very common thing in our society where you are driven and driven and driven and just expected to have this very successful career and then be on the pill because you're terrified of getting pregnant, and then you come off the pill and you're like, now what? Like
Yeah.
and 80% of the patients that I see in office and even in my online course frameworks are like, I don't even know what my menstrual cycle is or what. I just know I bleed every month and I don't know what my fertile window is. And then as like our culture dictates as well, you either turn to a Western intervention or framework, or you turn to a phone app to really determine your fertile window, which is, you're led down that path of expectation. So I really love to strive to turn the tide there and empower and educate people about their reproductive health and those choices and what those look like for them.
Yeah, absolutely. So for those who might be new to this space, like what is traditional Chinese medicine frameworks or whole systems medicine?
So, traditional Chinese medicine, or TCM, and also called whole systems medicine now, is really based on a medicine that's been around for thousands of years and served billions of people. And it basically uses Eastern philosophy and figuring out what that intersection of that human is between heaven and earth and what that place in that space looks like, and really takes into account the holistic point of view, which means that we look at the person's food, their nutrients, what their exposure is in terms of toxic chemicals and environmental load, toxic load. And then also things like emotions and spirit also really come into play. And obviously, working on the stress response is also another part of TCM. And it's not really sick care, it's more well care in the sense that the medicine is about stewardship in a way where we want to keep the body as optimized as possible so the person or individual can lead a really balanced, harmonious life.
Mm. So, in terms of Eastern versus Western medical or medicinal approaches to fertility, what would you say the main differences are?
Yeah, well, Western interventions take a Socratic approach to things and are very compartmentalized in terms of their systems. So the intervention is designed, the model is designed to really assess and treat in a very small amount of time. In Eastern philosophies, we really take into account, I mean, at least in the United States now, as we take into account everything that is going on in that person's life and how all of the systems very are really interdependent and they work together. Kind of like if you were to think about the Tai Chi symbol and the yin and the yang,
Hmm.
right? It's a very, very basic principle, but it means a lot, right? Because if you think about those two fishes intertwined, there's a yang fish with a little bit of yin in it,
Hmm.
and conversely on the other side. So there is this interdependency and relationship between the two things. And we always think about that interplay when we're thinking about working with an individual person.
Hmm. That makes sense. And would you say, I think at least in terms of experiences that I've been familiar with or I've heard about in people exploring their fertility in the more Western approach, it's testing, waiting, pills, IUI, IVF. Like those are the kind of outlined practices I've heard in the Western approach. And obviously, it's very medically driven, not too much talking about diet or exercise or those things. I think they're kind of in the back of what I hear. But how would your approach or an Eastern approach differ when someone is looking to explore their options to boost their fertility or explore that with their partner?
Yeah, there are a lot of foundational things that we do to set up the patients and their partners for success, right? So I love to say that fertility acupuncturists strive to make families and not just make babies.
Hmm.
I think that setting the people up foundationally and with basic tenements of living so that that baby is safe and healthy and enjoys a really optimized life. We give them the best setup possible. And I think that that is one of the best things that fertility acupuncturists strive to do. They're very dedicated and they're really supportive to creating a family centered life for the person.
Hmm. When you talk about acupuncture and fertility, I guess my mind is like, how do pressure points, how do needles help someone conceive? Like, that just sounds so interesting to me. What can you tell us about that?
Yes, I'm gonna hit this one hard.
Yeah.
I'm just going. Okay. So when we think about, first of all, I'm going to talk about acupuncture and herbs. And I think that making a distinction for your listeners is really important here. I talk about this all the time, that it's very important to have when you're looking at a fertility acupuncturist, making sure that they are very proficient in herbs and acupuncture. Acupuncture is stimulating points along a meridian system to harmonize the body, to ensure the smooth flow of what we call qi, which is a vital substance, throughout the entire body. So, in terms of randomized clinical trials, we know that fertility acupuncture regulates the nervous system. It helps improve peripheral vascularization to the ovaries and the uterus so that we're getting the best possible delivery system for medications if you're doing an IVF framework, or blood flow if you're thinking in terms of natural conception, right? So, balancing the endocrine system, regulating the nervous system, and getting better blood flow to the uterus and reproductive organs.
Mm.
On the other side of this beautiful salt and pepper shaker, we have herbs, right? So, albeit acupuncture is so powerful by itself, the herbs, they give me shivers. They really are transformative and they have a very profound, long lasting effect on the body. So, they are actually the pepper of the salt. If acupuncture was a salt, herbs would be the pepper, and they really complement each other. So if you have somebody that can work in both worlds, it's wonderful because your point selection and what you use on your acupuncture point prescription or your treatment should match what you're doing with herbal medicine, right?
Mhm. Yeah, absolutely. What types of herbs, and I know obviously every patient is different, everyone is kind of a approaching this with their own medical history, their own background, but what are the types of herbs that you recommend to someone to help them with their fertility?
So that really depends on the diagnosis, right? So there are what we call a differential diagnosis in TCM frameworks is really pattern differentiation. So we call them patterns. And so we will see things based on excess or deficiency, yin and yang imbalances. And then from there, we will complement the herbal formula, which we can individualize for the person right in front of us with single herbs as well. So that's pretty powerful. So all the herbs are working synergistically together in the formula. So a lot of times you'll have a compilation of herbs addressing all of the things that need to be balanced in a person's constitution. So how do you get to that diagnosis? Great question. So so basically how I work and most fertility acupuncturists work is I call it track before you try, right? So we want you to be set up for success with some sort of basal body temperature charting or something like the UVA kit, which is a piece of femtech where you can really predict your fertile window with alacrity and accuracy.
Mhm.
With a BBT chart, we've been using it for decades, right? So that'll give us a graphic representation of the yin or estrogenic follicular phase of your cycle relative to the luteal phase where progesterone is most in concert. Now, looking at that, what that graph looks like and what that image looks like will give the fertility acupuncturist the information that they need to create that pattern differentiation and select the right herbal formulas for the yin phase of the cycle relative to the yang phase. So, for example, if we have a diagnosis like liver qi stagnation, where we know that the brain is not communicating with the ovaries, and there's very like a sawtooth profile in the follicular phase, we can use a formula that's a classic formula called Free and Easy Wanderer. So, that is Jiaowei Xiaoyao san, and we know for a fact that that can help with what we call soothing the liver and regulating the nervous system.
Can you repeat what it was? Free and easy.
Oh, yeah. So it's Free and Easy Wanderer, and it's called Jiaowei Xiaoyaosan. So the Jiaowei Xiaoyaosan is the pinyin, which is the romanized version of the Chinese language, basically. And then we have the English translation. So when we graduate from herb school, we have this like huge, enormous book. It's very, feels like Harry Potter. And we have all of these really amazing, like hundreds of thousands of these beautiful formulas in this book. Like there's one called Benefit the Whiskers Decoction, which is all about preventing the graying of your whiskers. If anybody's interested.
That's so cool. Oh my
Yeah.
gosh, that is
Yeah.
amazing.
It's pretty cool.
And then do you also recommend or get people on a protocol of anything related to diet or supplements or mindfulness?
Yes, all of the things. And everything is driven by that constitutional diagnosis, right? So for example, if I see like a BBT chart that looks really out of balance, I will suggest phasing the foods to complement the acupuncture point selection based on what season or phase of the person's menstrual cycle they're in. And so we consider in TCM nutrition, the thermal energetics of food is as important. And we base that all on our 5 element system. We also consider the seasons. So, for example, in the early follicular phase, when it's cycle day 1 to about cycle day 4, we consider that the winter of your cycle. And so there's a lot of kidney energy during that time, much like when a seed is under the soil. So, when the seed is under the soil, we call that plan and prepare. And it's this really restorative time of a woman's cycle when we're trying to reassess and set the person up for success with their diet so that they can have a really successful fertile window and a successful implantation, right? So we want foods that are like beef stew, things that you would eat in wintertime, black beans, seaweed, things that are salty,
Mm.
so that we're really supporting the energetics of the kidneys during that time. So after winter, when the seed is in the soil, right? So then it bursts forth from the soil. And there's this really interesting shift if you look on a BBT chart where we're going from lower temperatures around 97.3 and then we're shifting up to 98.3. So it's a whole degree different. We're moving from yin time, which is this restorative energy of the feminine shade in the winter months, to this yang, outward masculine moment, right? Summertime is masculine, it is progesterone, it's heat, it's warming, and it's all the outward energetics of the summertime. But in between that, we have this beautiful time, which is moving from yin to yang. And this is when the egg is released from the follicle
Hmm.
and it goes into the fallopian tube, right? So during that time, we try to incorporate things that are in early spring that we would eat, beautiful things that you eat in your land, right? So, like asparagus is a great example, peas, pea shoots, things that are the young, kind of light, fresh vegetables, things that you would see in like a pasta primavera, for example.
Mm.
Yeah, right? Delicious.
Yeah.
Those light kind of energies of the vegetables. And then when we move into summertime, we're supporting the luteal phase and we're supporting that progesterone activity so that the embryo has a really beautiful place to implant. Remember that during the follicular phase, we're kind of setting up the uterine lining for the embryo to have success, right? So estrogen actually builds the framework of the uterine lining during that time. So there is some yin within yang, right? And then at the end, in the luteal phase, we have the progesterone kind of finishes off the uterine lining so that the embryo has a really great place to communicate and implant and hatch. So during that time, we would support more cooling foods, right? We have all this hot energy going on. So we would use things like cucumber or watermelon, or all of our happy melons would be wonderful during this time. And then at the fourth and final stage, if the embryo does not implant, we have autumn, right? So we have all of these things that are getting us ready for the long winter ahead. And this is our harvest, our harvest season. So we're going to use things like whole grains and things that are going to move us from that yang energetic inside of ourselves again so that we can rest up again.
Mhm. Yeah, that very much falls in line with, I think, a lot of people's cravings, like, when you're about to get your cycle, you're hungry, you want carbs, you want rest, you're kind of hunkering down for the winter. I've never thought about it that way, but that's exactly what it feels like.
Yeah. Yeah. And I think that there needs to be in our cultures more awareness around honoring the seasons of our lives, right? So, like the seasons of our cycle, and thinking about like, I challenge my patients. I have 5 trial lawyers right now. So, we're really working on some of these concepts. But like to think about, like, okay, stop. Like, it's okay to stop and rest when you are having your period. Like,
Mhm. Yeah.
right? Like, we're losing all this blood. We're supposed to be honoring the energetics of what's going on in our physical beings.
Yeah. I think so much of, you know, the 9 to 5 and working every day the exact same hours, like, women just don't have the same hormonal cycle as men do, where some weeks I'm, you know, ready to go. I'm so energized in my follicular phase. And then there's a week where I just have no energy and I'm a little bit slower with what I'm accomplishing. And that's okay because that's normal for women.
Yeah,
Mhm.
for sure. And I mean, I love the awareness now that we're, as in reproductive health, there's been this really lovely awareness that's been cultivated in the past couple of years. And I really love, I really want to be a part of it because just honoring how like, yes, we have periods. Yes, they're painful. Do they have to be all the time? No. And I just love that people are starting to hone in on that a little bit more. And also looking beyond just this one single treatment method, which is a general, I don't want to demonize it, but just having somebody just tell you to go on the pill for every single thing. I actually had somebody that was in the trying to conceive space, and a doctor told her to go to go on the pill
What?
for yeah, as part of her fertility journey.
Is it
So it's
because
just
I've heard that if you're on the pill, the minute you go off, you're, like, extra fertile? Is that true? Or have you heard that? Or why would someone recommend that if they're trying
I
to
don't know
conceive?
why this patient got recommended that.
That's
They said
so
go on.
bizarre. Huh.
Yeah. And so I don't know what it would be like in my framework. I just think that I challenge my own patients to really start getting real and educated around their health and know what their choices are before they make any decisions.
Yeah. Yeah, I love that. I wanna talk a little bit about stress and physical and mental stress on the body and how that impacts fertility. Do you discuss that with your clients often?
Yeah, I mean, there's tons of studies on this anyway. So, I mean, it's not me. It's not like I'm the first person to talk about this. But yeah, so we're exposed to a different level and different degree of stress, and it's a kind of a chronic stress. I'm pretty sure your listeners already know that stress is a response from there's a cortisol output that happens, and cortisol is we used it all the time when we were I just talked about this, but we use that all the time when we were running from the lion,
Right.
right? So I always think about like running from the lion on the veldt. And when we're doing that, we are our heart, cortisol helps our heart, it helps our lungs, it helps our fast twitch muscle fibers. But we're not going to sit in a field and braid each other's hair and make a baby or like grow nails or anything when there's a cortisol response.
Yeah.
So cortisol will almost shut down the fertility response over time, and the amount of stress that we're under now is it's that acute stress response that we had when we were running from the lion, but now we have it all the time. So our response is just constantly in this fight or flight state.
Yeah, I totally hear that, and I think it's so many different things, right? I think even just watching the news or getting really activated by kind of what's going on in the world can cause such a high amount of stress, and then you add on, you know, job stresses if you're in a really difficult job, if you've got financial stresses, if you've got family stresses, and then add the stress of trying to conceive and it not working for a while on top of that. It's so clear to feel like you need to relieve some of these pressure valves to find success if you want it, but it just is also so difficult when a lot of those things are kind of outside of your control.
For sure. And also really trying to figure out, and again, I think fertility acupuncturists do the we have a great community of fertility acupuncturists out here. So we talk about this all the time in my community. And we all agree to really try to meet the person where they're at in terms of what they can manage, in terms of understanding how important it is to regulate their stress response, right?
Mm,
So the trial lawyer who is slamming a cup of coffee while driving an hour in traffic to a meeting is not going to sit around and kumbaya, right? We've got to make
it's the baby
w-
steps.
we've got to start with tiny things. They have to be, great, you're at acupuncture. This is awesome. Okay, I'm going to do some auricular therapy and do some ear seeds for you. If you think about it during the week, please touch these. It'll help with the endogenous production of endorphins, right? So we've got to teach them and train them how to do that, right? And then maybe like, hey, that this is, we're building trust and partnership, and then we're moving from there. And then maybe we could listen to a meditation app by walking the dog or making dinner or some other thing. So it's not everybody has mala beads. Not everyone knows transcendental meditation. And I think it does not serve our community to have that expectation.
Yeah. What are ear seeds even? I feel like I'm so new to this space. I don't I don't know
Oh,
the basics.
oh, this is one of my favorite things. And so, and this is really amazing because one cool thing about fertility acupuncture is if you can't get to somebody to do an acupuncture treatment, you can definitely support them through telemedicine, right?
Okay.
So, like, we can do telehealth because there's things like castor oil packs, moxibustion. There's all of these other spokes to the TCM umbrella that are so powerful that you can do at home and have a really profound effect, right?
Mm.
So, ear seeds are based on auricular therapy and acupressure. And the ear is what's called a microsystem, akin to the maps that you see on a Chinese foot massage parlor, like when you go to get your feet massaged. So there's different organ systems that we can access within the ear. And what we do is we give tiny little either mustard seeds, or I use 24 karat gold seeds, and we put them on specific points in the ear so that we can access that treatment. So it will usually shadow the point selection that we did in the treatment that day, right? So you can find some for stress, and we use them a lot as part of what's called the NADA protocol. And the NADA protocol was developed for anxiety and addiction and recovery, I think in the 1970s. And it really put acupuncture on the map in the United States because it was so successful.
Wow. I wanna talk a little bit about the success and the data behind a lot of this medicine, because I think some listeners might be like, "Okay, how does this really work?" Or, "How does touching my ear or putting a seed in my ear really make a difference? How does it work?" Because one thing I saw on your website actually was acupuncture treatments before and after IVF procedures have been found to increase your chances of conceiving by up to 50%.
Yeah,
So,
huge,
even if this
huge.
sounds a little woo woo for
Yeah,
some, that is a
yeah.
crazy statistic.
That was crazy. I actually, as I was writing that, I was like, I gotta read that study. That's like
You're like, "Are you
amazing. Yeah,
sure?"
I know. So again, I said this at the top of the podcast too, right? So this is a great time to be a fertility acupuncturist. There are so many randomized clinical trials that are emerging, just really confirming what we've already known for, oh, I don't know, a couple of centuries around this medicine, right? So the herbs are a little bit more difficult to control. And also, most fertility acupuncturists are not pharmaceutical companies. So it's very expensive to run that type of trial for herbs. But in the context of acupuncture, it's really emerging as a darling adjunct therapy for IVF support, in the sense that what you were highlighting was called the Paulus protocol. The Paulus protocol was developed from in Austria a couple of decades ago, and it used a very specific point prescription 30 minutes before an IVF transfer, and a different point prescription 30 minutes after an IVF transfer. And so what they found out is that we're getting more, we're relaxing the nervous system and getting more blood flow, right?
Mhm.
So that there was a successful implantation. The other study that is really emerging in the current landscape is one that we know that when we use certain point selection on the lower legs, that we're able to access the femoral artery, and the femoral artery gives a lot more blood flow to the reproductive tract, right? So they actually went in and measured the rate of flow inside the femoral artery after they used these specific points. And so that point selection, I use that point selection a lot for retrievals,
Okay.
mainly IVF, in the IVF transfer process. And then I teach people. We have, I think we have about 30 kits now, but we have 30 eSIM kits, and they're from our community library. And so we send our patients home with those, and we teach them how to do TENS unit acupressure on the points before their treatments.
That is so interesting. And interesting you brought up working in conjunction with folks who are going through IVF. So do you work in sync with OBs and or fertility specialist in the more Western medical practice as well?
Yeah, 100%. I mean, I would say I would say that's over half of my practice now is really working a lot with IVF support, and making and developing. I do a lot of nutritional intervention just because we don't the reproductive endocrinologists aren't trained in the Chinese herbs, the TCM herbs. So they're just like, no, please don't mess up my protocol. So, and I kind of get it. Like it's just like it's super expensive procedure, and like I think it's very sad in the context of, like, for example, if somebody's doing an IUI and they're on a couple of rounds of Clomid, and we know that Clomid has this effect where it can kind of change the landscape of the uterine lining a little bit. And in TCM, Clomid also just damages our yin. So we want to be able to tonify that person's yin before they go into the next part of their fertility journey, right? So this would be like a really great use case for, like, okay, maybe I have a failed IUI or something. I'm going to give my body a break for 2 to 3 months and take some herbs, start working on tonification, start working with a fertility acupuncturist to really get that nutrition on par, wait 3 months, and then go into the next level of your fertility journey.
Mhm. Do some people come to you kind of after they've gone through a lot of the more Western medical interventions or interventions, and they're almost like, okay, I've tried the way that, you know, is popular where I live, if you're in North America, and now I'm looking to try something different or that's a little bit more out of the box, shall we say?
Yeah. Yes. I love being the last guy on the railroad. I'm totally like the caboose. Like, all right, well, we've tried everything else. I guess we'll just jump off the train then if this doesn't work. Yeah, I get a lot of like, oh my God, I've tried everything, even that blind shaman guy. So I guess I'll just go to you, Dr. Hoehn. But But yeah, we've had some really super amazing success stories. Like December was knock it out of the park month. I
Oh,
swear to God.
congrats.
I know. We have actually we had 4 patients that were in IVF frameworks, in like varying degrees, right? So some of them were like, I have endometriosis. I'm prepping for getting my body ready for IVF in the new year. And then 2 of them had polycystic ovarian
Yeah.
syndrome. And then another woman was the reproductive endocrinologist told them, I don't think this is going to be in the cards for you.
Oh, wow.
You're probably not going to get pregnant. And I don't know. I almost drove off the road when I found this out, but they all conceived within the same week
Oh,
in the
that's
office.
amazing.
And it's super cute. They're going to have their babies on the same, the same week
Oh
in
my
September.
gosh.
Yeah, so it was cool. It was really cool to be part of that process. And they worked so hard. I'm not even going to say that it was just like, I feel like I was just the parsley next to the orange wedge for those people. Like they really they worked so freaking hard. And that's the kind of like that's the dedication it takes. I
Yeah,
can't do
but it
everything.
must be so validating and eye-opening for a lot of people too to this practice and acupuncture and hey, this works. And so many people told me that it wasn't going to happen, and now that I've tried this, it has. Like, wow, what an amazing success story.
Yeah, it was an epic year. The only thing I'm waiting for to retire is for somebody to name a baby after me. Um,
That'd be so
but they
nice. I bet you someone
I
will.
know. I know. We do a thing, just a side note in our we're big on culture at Mighty River Wellness, my office, and we do this really cute thing where we have a baby altar because we're all about fertility acupuncturists are all about preparing the palace, right? So getting your body, getting your home ready and aligned and all of those energies aligned for having a baby,
Mm.
right? So when you come into the office, not only do you get a Moxa talk, but you also get a little card with your name on it. And then you do a working title for your baby. And we put that working title on a little card on our baby altar. And then when you have your baby, we send them customized flower designs with a little t shirt that says Mighty River
Oh.
Wellness. And then that picture of that baby gets put on the wall with their little card. So the baby name is not like Jack or Sarah or whatever. It's like we just had a trip hazard baby because the woman
Wait.
the woman had just moved to a house and she was falling all over the place and I was treating her ankles, her sprained ankles while I was
Okay, so it's
making
not
her
like your
baby.
aspirational baby name. It's like a funny or
No.
fun working
No.
name for while you're going through the process. That's
Yes.
so fun.
Yes, we had oh my gosh, it's a blast. We had 2 lawyers conceive and their baby's name is Baby Esquire, which is pretty cute.
That's so cute. Oh, that's so
Yeah.
amazing. Let's talk about male fertility. I know we've been talking a lot of protocols for women. Do you work with men?
Well, before I answer it, so the short answer is no, not really, and that's just because of the culture and because of the mindset,
Mm,
right? However, I will say this, and maybe I need to change my elevator pitch about this, but I don't know, you may or may not know that according to the data, the World Health Organization just recently just lowered the sperm parameters, the on a
yeah.
semen analysis.
It is going
Um,
down rapidly.
yeah, to a level that would not even be deemed fertile, like 2 decades ago. So
Really?
their response to the infertility is a global public health crisis.
Lower the bar. That's their
Right.
response.
Just do that.
Yeah.
Just lower the bar. What could go wrong, right?
Wow.
I mean, I don't really know what like I don't have any better ideas. So, okay, sure, but that's what we got. But you're getting guided into this by a western intervention where it's like, okay, this is I hear this all the time, right? Yeah, my husband got his sperm checked. He's fine.
Mm.
Right? Fine. You want to bring a fine baby into the world or you want to bring a super awesome baby into the world? Like, what are we talking here? So it's just really interesting. Like, I made a mini course on sperm health and success, and it's free to my patients. And I get on 15-minute consult calls with the male partner. And this is the sentiment I get. Like, the second I like answer every single call with this guy that's like arms crossed in front of me, like, yeah, my stupid wife made me do this dumb
Yeah.
call with this crazy woo
Okay,
woo
so they're
doctor.
not open. Is that what you mean by
No.
kinda like the culture and, like, just where people are at
Yeah.
with that? Interesting.
Yeah, I think people need to wake up though a little bit, right? Because obviously you want to bring your best genetic material to the table if you're
Mhm.
making a baby, right? Like you're not just doing it cuz your wife told you
Yeah,
to.
wouldn't you think they'd if they're if they're the father of the situation, they would
Yeah.
wanna be involved and, like, do as much as they can as well. That surprises me.
Yeah, and they did definitely have like a blind faith in like white coat syndrome kind of a little bit like of like, well, the real doctor
Yeah.
said that. And so I kind of vacillate. Like it just depends how much energy I have in my life. Like I sometimes just I'm so sorry to have this polarity, but like I just kind of turn my back to men sometimes and there's such an underserved community, but like it's just like I don't have the energy to pull the horse into the well and push their head down in the water.
Mhm. Yeah, if they were so you're saying if you came across, like, a gentleman who was super enthusiastic, really wanted to learn,
Yeah.
really wanted to
Oh,
do anything that they could, you'd be
I'm
super pumped.
running, doing burpees with them at 4 a.m. outside their house. Like I'm taking their trash out. I don't even. I'm just so thrilled that you talked at all and, like, have some I actually had a great patient exception in the role, and he was just like we sat down, he was the cook in the family because the partner was also another lawyer, but, like, I was like, "Okay, do this one pan dinner, do the" I'm really big into, organic gardening and herbs as well, so I try to have somebody bring a pot of herbs into their house or, like, teach them about the medicinal properties of certain plants so that they kinda hone into them and support their fertility naturally. So, he was all into it and all about it, and we did some great meal planning with him, but he's like a unicorn.
Interesting.
Yeah.
So, in terms of, if a guy was listening to this and they were like, "Well, I'm listening. I might as well hear what she has to say about how to improve my fertility." Do you have recommendations in terms of what men can do?
Yeah, go to an acupuncturist.
Okay. Okay, okay, interesting. So there are
Yeah.
acupuncture does work with men who are struggling with their fertility.
Oh, yes. We have an entire meridian system that there's a deeper branch that goes right to the scrotum. And so that's like the sperm factory,
Right.
literally. So, and then we have herbs, specific herbs that are really powerful adaptogens that can help with improving mood, sex drive, libido, energy, morphology, and there's tons of really specific diet and nutrition things that we can do to really turn the tide. And I've seen it a million times where the morphology, which is the shape of the shovel head of the sperm, is a little lower, it's a little off. And we're like, okay, let's get on this. Let's do some nutritional overhaul here and do some herbs and acupuncture. And the number changes all the time, it always improves.
Right. How long does it take to see the effects of acupuncture and herbs starting to work in either, men or women when they start working with you?
I would say put your seatbelt on because it takes about 3 months.
Okay. Oh, that's way
Yeah.
shorter than I was expecting.
Oh, really?
Yeah, 3 months isn't that long. Oh my gosh.
Yeah. Yeah, well, that's a recruitment of a follicle, right? So
Okay.
3 months is kind of that time where we start to see improvements in blood flow and peripheral vascularization, and the supplementation is really important too. So just making sure that those people are getting that that supplementation regularly can really make a difference.
Yeah. Interesting. You talked a little bit earlier about PCOS and endometriosis. Um,
Yeah.
is there a different approach to supporting women who maybe have those types of challenges with their reproductive system?
Yes, absolutely. So, in terms of endometriosis, we are working on blocking pain, right? So, like reducing pain as much as possible. As another adjunct note here, I will say this, that in response to the opioid crisis, acupuncture is known to be one of the most successful modalities. So, as you know, I don't know if you
Mm.
know, in the United States, the US started using acupuncture as part of Medicare in
Oh,
lieu of opioids. So it's got this powerful ability to block pain. So we
interesting.
kind of work on teaching the person how to then use things at home, things that they can do at home in terms of modifications so that they can reduce their pain. But the herbs and the acupuncture this is where they really shine the most.
Mm,
And then PCOS, polycystic ovarian syndrome, we work on the metabolic aspect the most, and then also making sure that there's the best liver function possible. So, mainly with PCOS, we're working on the insulin resistance and the metabolic aspect of the PCOS to balance the hormones. And that's where that really comes into play. And that's where it's very helpful to know your chart, right? Know your basal body temperature chart. This is a chart where you take your temperature, your resting temperature at the same time every morning. Just for those of you, we're doing an ebook for your listeners about this, but just so that they can get started at home. But this knowledge, it really serves as like a Rosetta Stone for you and your provider. So it's a report card. It shows you how the practitioner is doing and how you're doing on your milestones. And you can really see a PCOS, you can really see a cycle balance
Mm,
within, that's probably a longer framework. That's probably about 6 months.
gotcha. Interesting.
Yeah.
So we've talked about basal body temperature, BBT tracking.
Yeah.
Do you also recommend women utilize like ovulation strips if they're trying to find their fertile window? Do you recommend those?
Hard no.
Really?
So
Okay.
so yeah.
Do share why.
So, yeah, so this was actually, so I'm going to ball this up into my other super funny my soapbox about phone apps. I'm just
Okay.
going to say the same thing at once. So basically what's happening is OPKs, ovulation predictor kits, were based on a very antiquated algorithm by which that tissue paper is based on the sensitivity of that tissue paper. So the tissue paper that you urinate on is detecting a protein, the luteinizing hormone.
Yes.
And that's only present for one time in the body, right? So from when we get to an estrogenic set point at the end of the follicular phase, luteinizing hormone starts to take over. And that is the energetic from yin to yang shift we were talking about, so that the egg can be released from the ovary once it's developed, right? So that's based on the sensitivity of that concentration is based on the anticipation of a 14-day ovulation. And we know from the data that the founder of UVA, that she collected, that there's only 20% of the population that ovulates on cycle day 14. That's a mic drop for me,
Mm.
right? Because that is showing us that we are not serving our community. And so there was a study done a couple of years ago, and they evaluated 100 phone apps and what the algorithm that the phone apps were using. And those phone apps were predicting ovulation correctly only 19% of the time.
Oh.
So we're pushing people into these frameworks I'm not demonizing IVF at all, but we're pushing people into these frameworks way too early because they're getting underserved in terms of their knowledge about what their fertile window looks like. So
Mhm.
I always say just equip yourself with your own knowledge of your own body.
Mhm. So you would say that the temperature would be the best predictor?
I would say BBT charting is great for if you're working specifically with a fertility acupuncturist. And it's a great down and dirty way to hone in on your fertile window. I would also say to really check in with your cervical fluid, making sure that you have it. If you don't have it, then working with a fertility acupuncturist to figure out diagnostically what might be a challenge for you in terms of cervical fluid, but using something that measures the estrogen, the luteinizing hormone, and the progesterone. There's so much femtech on the market now that can successfully do that, that is not an ovulation predictor kit.
Ooh, okay. Do you have any
Yeah.
recommendations in terms of femtech?
Yeah. So I'm a big fan of the UVA kit, and the shameless plug, like I'm on the medical advisory board for them. So I made them be my friends. I I learned about the founder is a genius, and she struggled with her own infertility for 2 to 3 years before she got pregnant, and she wanted to have a bunch of blood tests done on to figure out and ascertain what her fertile window was doing, and maybe diagnostically what was wrong. And she just didn't think it was right in terms of reproductive justice that a man in a white coat had to like order a blood test to give her the keys to drive her own car. So that's why she developed the UVA kit, and it's been expanding into perimenopause and working on monitoring not just the fertile window but also what your cycle looks like in the later stages of life.
Gotcha. And then the UVA kit, for those who don't know what that product is, can you describe it?
Oh, yes, I can, because I actually use it in my clinic for naturally TCCing as well, because also you can put in your BBT chart into the UVA app. So it's a phone app, and it has a QR code on the end of a very highly sensitive tissue paper that can measure all of those and monitor all of those hormones.
Okay.
And then you scan the QR code and it goes into an app on your phone. And then what you can do is what we have all of my patients are on the UVA kit. And so I can have that be a piece of communication while I'm working and collaborating with a patient on their fertility. So when they come in, I can see their chart and I can see what that looks like, and I can see what the interventions that we're doing in terms of the point selection and the herbal selection at that time, so that I can make course adjustments as I need to.
Gotcha. No, that's really cool. I'm surprised about the ovulation test kit. I've had a lot of friends say they swear by it because even I guess one question for you, even if you weren't on a 14-day ovulation cycle, would the luteinizing hormone not show up even if it was later on the kit?
This was one of the first things that, like, really turned the tide for me, was that people are having sex way too late, right? So they were missing that viability. So remember, the egg is only viable for 24 hours. Sperm can live in the tract for 72 to 75 hours. So people were missing that because they were really relying blindly on the OPK. And so they found with a lot of the femtech products that people are ovulating, their fertile window is a lot longer and a lot earlier than
Oh,
what's coming up on the OPK. So it's not registering on the OPK, so it looks like they're not ovulating.
interesting. Yeah,
Yeah.
wow, that's so surprising because I think a lot of people reach for that, especially when
Yeah.
they're in the phase of really trying and wanting to track.
Yeah. It's very frustrating. And people come in with phone apps all the time too. And like you're like, this isn't obvious.
Yeah.
Like, this isn't
I think
working.
they're helpful for just tracking your cycle, I think. I think a lot of women find it useful, especially if you have irregular periods, to be able to kind of house that data somewhere in like a UI friendly way. But you're right in terms of the actual predictive data that they're providing you, I'm not as sold on that either.
Yeah. Well, the other thing too about the femtech now is that we're getting like this again, turning the tide. It's really intriguing. Nobody really cared about progesterone, except for fertility acupuncturists, really, because we want to see what it looks like, right? So, like, again, without yin, there can't be yang. So it's not like we're gonna just treat. Oh, that's cool. We're just gonna treat the follicular phase, right? We would never do that. And so it's been a cool nod to the broad expansiveness of a woman's cycle in terms of the fertile window and what the setup looks like in order to have a successful pregnancy. And so that's what a lot of these femtech companies are doing now, that makes it really helpful for the person has access to their own data, right? That's their health data. They should be able to do their own monitoring when they want to do it.
Yeah, absolutely. I'm so excited about femtech even just blowing up right now.
Yeah.
I think I saw, and I don't know if this is legit because I saw it on TikTok, but someone was saying that they had only just found out why morning sickness occurs
Yeah.
like this year. And it was like, why aren't women prioritized in health, the health and medical community? That's insane. If women have given giving birth since the dawn of time, and you're just finding out why one of the most common early pregnancy symptoms is happening.
Yeah. Well, I
Nuts.
mean, because it's not happening to the
I
patriarchy.
know, it's that just makes me so angry. Um, let's talk a little bit about pregnancy though, because I know you of course work with women as well who are in the pregnancy phase and postpartum. So how does acupuncture and holistic medicine support women who are a little bit further in that journey?
Basically, in specific things that I really work on is I focus once a person's pregnant, then we really work on the first trimester, right? So we're just like working on that really horrible fatigue. We're
Mm.
working on that the crippling nausea, and also this notion of, I want to talk about moxibustion just for a hot second, if it's okay with you.
Yeah, what's that?
So moxibustion is a herb. It's called mugwort, and it's pressed into a pulp, or you can roll it into a piece of like a cone. For the purpose of this discussion, we'll use the pulls the most. And so what you do is you drive the medicinal properties of the herb into the dermis using heat therapy. It's a heat therapy. And so in TCM frameworks, we only ice our dead, and we use warming to heal all the time. So bruises, contusions, we're going to use a lot of herbs that warm and move instead of and circulate rather than freeze and desist, right?
Okay. So the
So
herbs go into the skin.
so the smoke allows the herbs to go into the skin. So
Interesting.
this is mugwort. And so we use mugwort mainly for what's called calming the fetus. And again, I did not know what this was when I was in the camera department, but it means to get better blood flow to the embryo, right?
Okay.
So people continue to do moxibustion throughout their first trimester. And then we use auricular therapy for them to work with a specific point prescription in the ear, acupressure point prescription in the ear, so that they work on what we call stomach chi rebellion. So, stomach chi rebellion is that nausea feeling, that morning sickness, right? I also teach people how to use acupressure points on their feet so that they're working with the nausea and vomiting points at home. So, we use that for pregnancy. And then when we get farther along, I'll just be honest with you. I don't really see people in the second trimester. I see mainly people in the third trimester, 3 weeks
Mm,
before their due date for labor prep. So
right.
labor prep is there's this really specific set of a protocol, and we teach the partner what to do during labor, and we kind of train them on specific acupressure points, and then we also train the partner how to get the body ready to receive the baby, so have the baby. So those are points that open up the hips and all of those deeper channels so that we can work on a really healthy delivery.
That's so cool. It doesn't surprise me that no one sees you in the second trimester. I feel like everyone feels their best and they're like, I'm
Yeah.
fine. What are you
Yeah,
talking about?
what? I look great. I'm just wearing these expanda pants. Yeah, and then postpartum, I forgot to talk about that, but there's this beautiful thing in Eastern philosophies called the golden month, right? So
Okay.
this whole idea which is really beautiful, and I wish we embraced it more in this culture, where the baby and the mom are still developing during that month. And so the tradition is that you stay home and you have all of your grandma, your aunts, and like all of the women in your tribe and your family around you to help and support you. And then the nutrition during that time is really interesting. It's all of these herbs, again, herbs and nutrition that would support the kidney meridian, which has to do with reproductive essence. And then also a lot of blood tonic herbs and foods like goji berries, Chinese dates, a lot of medicinal broths like congee, which is a rice porridge that you can put a black bone chicken into. So there's a great book on it called The Golden Month, and this amazing acupuncturist wrote it, and it's just a really amazing thing that people don't think about postpartum and using acupuncture and TCM support.
Yeah, absolutely. I've heard of people referring to the fourth trimester, kind of that phase following birth of baby, not in the sense of acupuncture, but just in that it's so hard, it's still so connected, like mom and baby are basically attached for that time. And just kind of recovering and recovery from birth and everything that happened in delivery.
Yeah. I don't know if you know this in our country, but there there's a group of senators that don't think it's necessary for corporations to allow maternity leave because they don't think that it's necessary for a female to go on vacation.
That makes me so angry. Like being we're so I feel very blessed to be in Canada just because
I
we
know.
get 12 to 18 months and you can kind of pick. You can come on
Yeah.
over. But I could not imagine even the places in the US that offer maternity leave or something like 8 weeks or 12 weeks. I'm like, that's not enough. Are you insane?
You just had a baby. Yeah, but I just can't even, like, your body has completely changed, and like,
And also your newborn needs you basically all the time
yeah.
at every hour of the day
Yeah.
and night. That I can't imagine how tough that is
I
for a
know.
woman in
I
the
heard that
States.
this morning. Colleague told me that this morning, and I was like, "Wow, this is another use case for moving to the Arctic Circle."
We've got our own problems up in Canada, but maternity leave is not one of them. I will give us
No,
that.
no, no, it's not.
No, that I can't imagine. Do you think that'll change in the future? I think a lot of progressive companies are, in order to compete for talent, would offer more, but I also think we're in kind of a recession right now, so it's not anyone's top priority at the moment.
Yeah. Well, we're in a dark ages time in reproductive health here in this country, which means that most of us that are in fertility frameworks really need to start getting more empowered and involved in these choices and like really work on the activist level. I know we talked about that in the pre-interview a little bit, but and also this is another really important use case for really getting involved and empowered and educated about your own choices, right? And like know what those are now and how they've shifted as we move through this society and this collective consciousness time where it's really regressing.
Yeah, and knowing your rights as
Yeah.
well.
Yeah.
Um, do you have any kind of general advice for men and women, couples who are looking to become pregnant? Or secondarily, what would you say to people who are maybe have been hesitant or haven't been curious to explore this Eastern approach to fertility yet?
Yeah. I would say give yourself 6 months getting your body ready. Even if you think that you're super healthy, there's a lot of environmental exposure and there's a lot of energetic work that should happen between the couple before you start even trying to conceive. And then acupuncture is not, it's like diving, right? I was also a dive master for a while. And like, if you don't want to scuba dive, you shouldn't scuba dive. And it's the same thing with acupuncture. I could sit here all day and talk about how much I love it. But if you're not ready to embrace or explore that healing modality, there is another thing out there. And you really need to find what resonates with you. I would also say another piece of advice is get your care team together, right? Assemble your own dream team. There should be somebody on it that like you inherently want to have on your zombie team and you feel like you want to run through the fire with them in the context of like an IVF doctor. I need calm and cuddly. I can't have cold and callous in my life, right? I don't follow directions well as an individual. And I need a lot of hand holding because the process is really freaking scary. And there's a
Mm,
lot that makes sure that you know how you're comfortable disseminating any information, following instructions, and like vibing a person and a doctor is really freaking important during this time.
yeah, yeah, absolutely. You have to have that trust and that rapport for sure.
Yeah.
Perfect. So, if listeners could take one thing away from our conversation or your message, what would you want it to be?
I would say give yourself time, have patience, and know that this is a pivotal, transformative thing that you're doing. You're building an entirely new person. Give yourself grace and give yourself time, and know that there is somebody out there that is willing to support you.
I love that. All right. Where can people get connected, learn more about Mighty River Wellness, and all of your resources?
So we're pretty active on Instagram at Dr. Beck Hoehn, which is just my name. And then I have a fun support group. We talk about herbs and plants and BBT charting and all of those fertility tips on Sundays. I do a Facebook Live on Sundays, and that's called The Bun and the Oven Buzz. And the group is called, if you're in the group, you're called a bunny. It's pretty
Cute.
cool.
I love that.
And then we're starting I'm developing, I'm going to be in the second cohort now, but I have a project called the Positive Pregnancy Project and that's going to be launching in June. And in the interim we have mini courses that are called Make a Baby Bundle and that's all about sperm and egg quality and how to optimize those for yourself. So you can also check out my website for my brick and mortar, my office, which is Mighty River Wellness.
Amazing. Dr. Hoehn, thank you so much for joining us today. This has been such an awesome conversation.
So fun. I'm so excited that I got to meet you.